Welcome everyone to our webinar today, Analytics for Health and Human Services Agencies. My name is Jonathan Linchek and I'm the Director of Technology and Strategy at Copley Consulting Group. My background in analytics goes back about 20 years, originally with Oracle Corporation, then with Cognos. I spent most of my heyday as well as Cognos' heyday over at Cognos in a number of different roles. I ran the Cognos public sector team for over 10 years. As well as running their SPSS organization once they were acquired by IBM, as well as being the CTO for business analytics at IBM. Today, we're going to walk you through a short webinar where we're going to spend most of the time walking through a live demonstration of some of Copley and Qlik's analytics for health and human services agencies. As I mentioned a little earlier, your phones are on mute for this webinar. Please feel free to use the chat if you have any questions or any issues, and we will work to assist you as we can. So to begin, really what we're here to talk about today are decisions. If you think about all the decisions made every day in your agency and how those decisions affect the lives of your constituents, you might be blown away. What cases to focus on, where to dedicate extra time, who to hire, what potential fraud cases to investigate, where to spend your money. All of these decisions can affect the funding the agency gets. All of these decisions can affect people's lives. And that really is why all of you work in government, I imagine, to make an impact on a daily basis to those that you support. But surprisingly, many of the decisions that all of us make are still made with gut instinct instead of with data and analytics. And unfortunately, despite how much we think otherwise, our gut instinct is often not the best. I have a short example I like to use to illustrate this before we get into the demonstration today, called the Monty Hall problem. And I'm not sure if any of you are familiar with the Monty Hall problem, but it's pretty famous. You can certainly go out to websites and Google and find some information on it. But the Monty Hall program is focused around an old game show called Let's Make a Deal. So the younger folks listening in, you may not remember this, but it's a pretty famous game show on daytime TV. Everyone would dress up in the audience in fancy costumes, and Monty Hall was the host. And he would run a number of different games throughout the show. And for one of the games, he would bring someone down from the audience, and he would show them 3 doors on stage, or maybe 3 curtains. And he would let the customer know, or the client know, that behind one of those doors was a brand new car or some fancy prize, like a vacation or a boat that they would want to win. But behind 2 of the other doors was a terrible prize, maybe a family of goat herders or a number of cows, some prize that let that contestant know that they had lost. So Monty would let the contestant know, you get to pick one door, and when you go home today, you will take home whatever is behind that one door. What door do you want? And the contestant would look up to the audience, and the audience would be screaming numbers at them. His wife might be saying, take door number 2. His family saying, take door number 3. And the contestant would say, okay, Monty, I'm going to go with door number 3. Now, Monty worked for the game show, so he knew where the car was. He knew where the goats were. So he could now negotiate with the contestant to try to get them to end up with a door that might not be the car. And there was a number of ways Monty would do this. One thing he would do is that he would say, okay, what if I told you that one of the goats is behind door number 2? Now the contestant would feel even better about the choice they made. They were going to choose door number 2. Their wife was screaming door number 2, but they felt really good about door number 3. Somewhere in their gut, they knew that door number 3 is what they wanted. So Monty would now ask the contestant, okay, now that you know that there was a goat behind door number 2, do you want to keep door number 3, or do you want to switch to door number 1? The contestant would think about it, they'd listen to the audience again, but in most cases they would say, you know what, I'm going to stick with door number 3. I feel really good about my choice of door number 3. I got this gut. Now Monty could try other things. He could say, okay, Mr. Contestant, what if I gave you $100 to switch to door number 1? What if I gave you $300 to switch to door number 1? Would you switch then? And again, the contestant might say, no, I don't want to switch. So ask yourselves what you would do. Would you keep door number 3, or would you switch to door number 1? Many studies have been done of this problem, and for most people, they don't switch. In fact, only 13% of people in studies would switch given this exact scenario. But what the math shows and what the analytics shows behind the scenes is that switching actually doubles your chances of winning the car. And for most people, this blows them away. The first time I saw this, I just didn't believe it. I don't understand how switching can double your chances of winning. And we don't have time today to go into the math and the proof steps to prove it out. I recommend you Google it if you don't believe it. But once you kind of understand what's going on, you will see that switching actually doubles your chances of winning. So think about it. The reason I show this example is it kind of shows some of the difficulty in focusing on our gut instinct as human beings. If our gut instinct makes the wrong decision in a simple game show game like Let's Make a Deal that's been on TV for decades, how difficult is it going to be for us to make the right decision in more complicated situations? That is why we use analytical tools in our jobs within these agencies. That's why we look to solutions such as Qlik and the different solutions that Copley Consulting offers. But unfortunately, when we talk to many agencies, many of them are not using the legacy analytics tools that they have successfully. And I did this a lot in my role as CTO at Cognos. One of my main roles was to go around, talk to the customers that had already purchased Cognos and understand how they were using Cognos, what they were using it for, and where their difficulty lies. And trying to understand why more people within those agencies weren't using those tools. And in fact, when I talked to the customers, only about 10% of potential users in an agency were actually using the tools that they already owned. And when we talked to them about why this was, it came down to 3 things. Either they didn't know how to use those analytical solutions, the users didn't have time to use those analytical solutions, or the tools that they had access to were just too difficult to use. This is what I saw over and over, unfortunately, with Cognos users as their field CTO. Our customers struggled using the solutions. It was extremely slow performing, and it was very difficult to use. And unfortunately, in my final years at IBM, what I saw was that they had kind of stopped investing in the solution. They had kind of put together a confusing product strategy with Watson Analytics, Cognos Analytics, some of their new machine learning capabilities, such as the Data Science Workbench. And it turned out that these BI tools and Cognos were no longer a focus for them. And that is why I have teamed up with the Copley Group and Qlik to provide modern analytics solutions for health and human service agencies and other government entities. Qlik realizes that the more people that they can get using analytics, the more value that you can get from it, the better outcomes that you can drive, the more successful we can make our agencies overall. So what I'd like to do is walk you through an example demonstration that we've built out for a number of agencies across the country. And again, this is just a sampling of some of the power that we can bring to your agencies, but wanted to give you kind of a quick feel over the next 20 minutes so of some of the possibilities for you. So right now we're in a web browser and we're accessing our Health and Human Services application, and the look and feel can look however you want it to look. This is, again, just one example of the type of thing that we can do. So at a high level, I can start out by seeing the number of recipients I have on our Temporary Assistance for Needy Families program. I can see our overall worker participation rate, which obviously is a key metric in that not only does it tell us how we're doing in helping get our constituents back to work, but it also affects our federal funding that we receive if we don't hit certain guidelines. I can see the numerator and denominator that make up that worker participation rate and how it's changed over the last few months, as well as how many people we have approaching the limit of their TANF benefits at 60 months. The environment that we provide is extremely easy to use because we understand that people, don't have to code. They don't want to have to use SQL statements. They don't even want to have to cycle through a number of different columns. So if I was a caseworker manager and I wanted to come in and find a specific data element, it's as easy for me as a simple search. I can come in and say, you know what? I don't want to search a specific database or specific column. I want to look at all the data I have and find anything relating to Baltimore. And what I see is not only some example visualizations that contain Baltimore, but I also see that there's a recipient named Valerie Baltimore that I might want to investigate. There's also a county named Baltimore and Baltimore City. So there's a number of different things that come up when I search on Baltimore that the end user could very quickly get to. And that really just demonstrates quickly the power of search for our caseworkers and our caseworker managers. An individual can also quickly click around and focus specifically on the information that they care about. So if I only wanted to see a certain date range, I can use my mouse to simply drag and drop around that individual date range if I'd like. I can even click on individual bars to focus on specific bars. So if I only wanted to see recipients who have received benefits between 50 and 60 months, I simply need to click on that bar. So very easy for me as a user to manipulate around. And you notice everything is always connected and interactive. Whenever I make a selection in one visualization, it changes all the other visualizations, so I know that I'm only ever looking at things that are focused together. I can even drill down to a lower level if I want to see the breakdown of people that have been on TANF benefits for 52 months versus 55 months versus 59 months. A simple click gets me to that level of information as well. So very easy for me as a caseworker, as a manager, as the head of the agency to manipulate and see the specific information I care about. And in fact, that same interactivity is available out to the public in an extranet type model as well. So if you need to make some information transparent out to the constituents of the state, if you have requirements to meet, if you have Freedom of Information Act requests that you have to fulfill, you can embed the exact same data within your website and keep it interactive as well. So if I, as a public user, came into the website and I was interested in recipients between the ages of 18 and 25, I simply select that piece of the pie, and again, you notice that the entire website changes dynamically. This is a built-in capability to the solutions that we offer, so that you don't have to go and code a lot of this complex logic behind the scenes. So let's kind of continue with our story as the caseworker manager. I might come into my dashboard today or my environment, and I want to focus on a number of our different case offices. So that I can manipulate around our map. I can drill in and pan and zoom and get to whatever level of detail within the map that I see fit. If there are certain case offices that I want to focus on, I don't have to go through a complex filtering criteria in order to do it. I can simply click on my map and draw a circle around the case offices that I care to focus on today. So very easy, again, for me to get to the specific areas that I am interested in. Once I focused on those case offices, you'll notice that it actually adds that filter to my top bar here. So I know for the rest of my analysis, I'm focused only on those specific case offices. I can now drill in and start to understand some detailed information about those counties and those case offices. Now I see a visualization showing me the average core activity that we're driving with our recipients within each county, as well as the average number of TANF months that each county's recipients have had. On the right-hand side, I see aggregate values for each of the 12 different activities that roll into our worker participation rate. So I can see how much unsubsidized employment we're driving, how much work experience we're driving, how many hours of time a week our recipients are spending in job skills training. All of that's available to me at a detailed level. But now I can start to look at outliers and start to understand which case offices might have problems that I need to investigate. For example, if I look at Carroll County is a bit of an outlier here because they're not driving as much core activity as my other counties, although the number of TANF months that their recipients are receiving is actually on the early stage. If I want to dig into Carroll County, I can simply select that bubble and drill in. And now I can see each of the individual case offices within Carroll County. Again, if there's an anomaly here or if there's an outlier, it becomes very apparent visually. Whereas if I was looking at the raw data in a spreadsheet or in a more complex report, it might not be as obvious to me that our case office 25 is really underperforming compared to the other case offices in that county. So again, maybe I want to select that specific county. When I do, you notice again on the right-hand side, the detailed participation hours changes to focus only on that county. And now I can drill down, and if I have the right permissions, I can see the individual caseworkers within that case office. So now I can see that folks like Robert over here are doing a decent job at driving their participants back to work by driving additional work activities. But someone like Chantel Finch here in the upper left, she's struggling in this area. She's only averaging about 18.3 hours a week of core activity for her assigned recipients. And in fact, a lot of her recipients are starting to get up there in the months of TANF that they have, which is starting to be a concern to me, because if they start to reach that 60-month threshold, it could mean a negative outcome for them and their benefits will run out without them returning to work. So again, maybe I want to drill into Chantel and understand what's happening with each of her individual TANF recipients. And here I can see a whole number of people, right? I can see Freddie Smith is almost done with his benefits, but he has an exclusion because he's a student. I can see Irma over here also has an exclusion because she has a child under the age of 6, but her benefits are almost up as well. And if I wanted to kind of change my focus here and say, you know what, I'm not interested in people with young children. I'm not interested in looking right now at people that have a disabled flag. I want to focus only on those folks that are not excluded so I can understand if any individual recipient has an issue. I can kind of clean up my display. And now I see there's folks such as Clarissa here, Clarissa Tamonte, who's only getting about 6 hours of work participation activity a week, but she's almost at that 60-month threshold. So as you see, we kind of started at a high level, looking at all our counties and understanding how they were doing at driving their worker participation rates. We saw some issues, we saw some anomalies, and we're able to drill down to an individual recipient. Again, if we have the right security permissions to do so. And now that I've found a potential issue, I can look at an overall 360-degree profile from all of our different systems, pulling all that information in to get one view of what's happening with Clarissa. So not only am I looking now at her TANF benefits, but I can understand if she's receiving child support, in which case she is about $1,700 a month. I can see if she has any foster children. I can see if her and her children have gone through their immunizations. I can see if she's on our home energy program. All sorts of metrics and information about Clarissa pulled from multiple data sources into a single view. When we work with human services agencies, this is one of the hardest types of views for them to get, and Copley and Qlik together make it pretty easy for them to pull that in. Not only do I see some high-level metrics, but Qlik is able to do some advanced analytics behind the scenes. For example, Qlik has built-in routing capabilities to show the best route between different points. So now I can see the fastest route for Clarissa between her home and between the case office that she's assigned. I also see that Qlik has calculated that at this time of day it's going to take her about 105 seconds to drive that route because it's only about 450 feet. Other analytics tools, it would be very, very difficult for them to calculate information such as that, where Qlik includes it out of the box to create that type of routing. We also have a lot of experience at Copley with machine learning algorithms and the ability to do things such as anomaly detection for understanding fraud. Again, I spent four years of my life leading up the North American SPSS team. So, we have a pretty good understanding of what it takes to look at and do some of that more detailed analysis. And what happened here is we ran those machine learning algorithms behind the scene, and it's actually identified potential fraud related to Clarissa's food stamp program. So if we want to investigate a little further about what's happening and why a fraud flag is showing up for Clarissa, I can simply click on that button and it'll take me and drill me into another visualization showing me what's happening with her food stamp spending in her SNAP card. So now again we have another geospatial display, this time showing me where Clarissa lives, as well as red bubbles showing me everywhere that she has spent her food stamp dollars over the past few months. So I can see that she has a number of different spendings close to her home, but there's actually a large grouping of spending, about $1,500 over the past few months, far away from her home at Dave's Tires. And if I wanted to, I could even understand how far away that was using the built-in capabilities of the map. So, I can look at how far out 15 kilometers were versus 30 kilometers. And I see that it's about 50K from Clarissa's home where she's spending these food stamp dollars. So likely this is why our algorithms behind the scenes called out potential fraud for her food stamp case. Why is she spending so much money, and why is it so far from home? Just like Qlik has routing capabilities, we also have built-in capabilities to do things such as drive times, so that I could actually append on top of my map a visualization showing me how far Clarissa could get within a 10-minute drive of her home. And you notice, it's not a perfect circle, because some streets are going to be faster than other streets. If she has the ability to get on a highway, she's going to be able to get farther in 10 minutes. So I can understand if some of this spending is within 10 minutes from her home versus some of it that might be outside of that guideline. So very easy for me to start visualizing that information. And if I wanted to, I could even focus on all the different recipients that were rolling into Chantel Finch as a caseworker. So I could bring on multiple people now onto the map. You notice the drive time for this individual is much different than the drive time map for this individual, but both of them seem to be spending a decent amount of money up at Dave's Tires. So this is a big issue for me if I saw this investigation and I was seeing this data. So much so that maybe I want to send this information out to a fraud investigator. So we can have a fraud investigator who's in the field, who's traveling around. Maybe we want him to go up to Dave's Tires and start to understand what is occurring. But these fraud workers, right, and in some cases even our caseworkers, they're not folks that are sitting behind a desk at a desktop computer every day from 9 to 5. This is someone that's out driving around the area and needs mobile access to the same type of information. So this is another powerful feature of this solution that we have for healthcare and health and human service agencies, is the fact that everything that we provide is automatically available in a mobile component, not only for viewing, but also for creating new content. So let's say I noticed that fraud situation and an alert went out to me as a fraud investigator that here's some data points that you need to look at because it involves potential fraud. And we could actually email this fraud investigator a raw spreadsheet of this data for them to take a look at. But like most things in spreadsheets, right, a fraud investigator is not really going to be able to do anything with the data in this format. So he or she might want to go ahead and save this information to their iCloud drive so that they can now come into the Qlik environment and start to investigate that data. And again, we're able to do this directly from our mobile device, whether it's an iPad or a Galaxy phone or an iPhone, whatever mobile device you use. Qlik automatically resizes everything and provides this capability to that user. So if I wanted to say create a brand new application on my mobile device, I could give it a name. I could call it my test of human services information. And I could say I want to create a new application using this brand new data that I just received. From here, I can choose to add additional information. I could go out and connect to any of the data connections that my administrative staff, my IT staff has set up for me. I could choose to create my own new connection and connect to a database, a spreadsheet, my Salesforce systems, my ERPs, my big data Hadoop systems, my Hive environment, whatever it was. I can even go out to the live Qlik data market, where Qlik makes available some cloud-sourced information such as weather and demographics and sensor information. So I could actually tie in what the weather was like in all my cities on an hourly basis over the past year if I'd like. But in this case, we're just going to directly connect to that spreadsheet that was emailed to me so that we can start to investigate what's happening with our food stamp fraud problem. So again, I see a quick preview of the data that we had just forwarded in that spreadsheet. I can prepare that data and again, directly from my iPad, load that information up so that I can create a brand new visualization. So this is the exact same look and feel that a user would get if they were doing some analytics themselves on their desktop, but I'm able to do it within the iPad. And you'll notice the power of what I'm able to create from scratch. So for example, I can go out and I can grab any type of visualization that I would like. If I wanted to bring a map into my visualization, I simply drag and drop my map item onto my screen. And now I can say, you know what? I want to map the different locations of the stores where my individuals have spent their food stamps. So now, just like we saw before, I have a map available to me with all the pan and zoom capabilities that I have come to expect. Maybe I want to add a line display within my visualization as well, so I can resize and create a brand new line display. I can use my date field, which automatically gets relative time capabilities created. So I can say I want to look at the spending amounts of food stamps by my year and by my month. I can even go out, and one of the greatest things about the Qlik environment is the extensibility of the solution, because I can even go out and grab visualizations that have been created by any of the 30,000 Qlik users across the world. And I can pick and choose visualizations that weren't necessarily embedded with Qlik, but that someone built because they saw a need for. For example, in this case, someone wanted to build a visualization showing windmills, where the windmill would spin faster the higher the measured number was. So I could come in here and I could say, you know what? I want to view those windmills by my different store types, and I want to visualize it based again on the amount spent. So now I have an interactive visualization with a map showing me my food stamp spending by month, and the faster that store windmill spins, the more money that is getting spent in that location type. And built into this is all the drilling capabilities that you came to expect, right? So I can simply use my finger to select and filter on different items. You notice when I do so, all the other visualizations automatically change. I can even do that lassoing that we saw earlier to select individual locations and focus specifically on those locations and watch as the data changes from there. So to me, you know, as a 20-year analytics vet, you know, years at Cognos, years with Oracle, years working with Tableau and Qlik and all these solutions, I am blown away at the power of Qlik for solutions such as this, and how easy it is for that end user to create something on the fly. So that's really the overview of what I wanted to show today. I'm going to go ahead and take a quick pause from the sharing so that I can look and see what questions that we have here on the chat. Okay, good. It looks like we have a number of questions. If you have any questions, feel free to use the chat to go ahead and share that information now. The first question is around comparison to other analytics tools. So how does Qlik compare to other tools like Microsoft and Tableau? That's a very good question. Let me go ahead and go back into the presentation because I think I have a slide that can address this. There we go. Let me find it here. Okay, good. So how does Qlik compare to the other analytics tools such as Microsoft, Tableau, MicroStrategy's, SAP? So one of the reasons I made the decision to join the Copley group was prior to me coming on board from IBM, the Copley group had done a pretty advanced analytics evaluation. They had come in and tried to understand how do the major vendors out there compared from a performance, scalability, ease of use, interactivity capability, as well as things like a fit for public sector. Is this tool, which might be good in the commercial market, is it a fit for public sector? Does it do things such as cohort analysis? How does the extranet and public capabilities work for embedding content on our agency's website? How is the performance going to be handled, right? So Copley looked at all of those things because they wanted to be able to provide the best tools and the best solutions to their customers and to their agencies. And what they found was actually that Qlik excelled in every single area that they investigated, where a lot of the other solutions started to fall down on things like performance or things like how much of a fit is it for public sector. And this is not just Copley saying this. If you look at what the analysts are saying about Qlik, right? Gartner just ranked Qlik in the leaders quadrant for the 7th straight year, which is a record for analytics vendors. Other vendors, other analysts, such as the BI survey, which instead of doing their own analysis, they go out to actual users of the products themselves and interview them to understand what's their overall product satisfaction in a number of different areas. Qlik comes on top on that BI survey as well. Analytics surveys such as the Butler survey actually compared Qlik to Tableau and Microsoft and all those other solutions. And again, Qlik came out on top. So Copley feels very good about how Qlik is the best solution for health and human services agencies. And we're really seeing that in action as we continue to work with some different customers. The next question I saw are questions about the licensing aspects of external users. How is that done? I don't want to get too much into licensing today. However, Qlik has a number of different ways, and Copley has a lot of flexibility for how we license these types of environments. Certainly, you can license them on a user-by-user basis, which is good if you're kind of trying to get started with only a handful of users. But what we see most agencies doing is buying out application licenses where they don't have to count internal or external users as long as they're using the solutions in that way. So that way you can kind of provide information like we saw in that example website where we're embedding the content within the website without having to worry if there's 10 people hitting it, 100 people hitting it, or 1,000 people hitting it. The other nice thing about the Qlik Copley solutions is you're able to run this on-site and on-prem if you'd like, but it can also be run in Microsoft's cloud. It can be run in AWS. So you can kind of get some of those dynamic scaling capabilities that are necessary if you're trying to scale out to potentially hundreds of thousands of users on your public website. There's another question here about how security is handled. So let me get back over to the demonstration, and I can kind of walk you through security for a bit. So this is kind of just a demonstration portal where we're able to impersonate a number of different users to see how Qlik handles the security behind the scenes. Because we know, especially when we're dealing with healthcare information and food stamps, this is extremely sensitive information. So we need to ensure that the users that are connecting in the environment only see the applications they're supposed to, only see the data that they're supposed to, and we also want to, in a lot of cases, limit their ability to interact with that data. Some users we want to be able to do anything. Some users we don't want to have the permission to even edit the screens that they see. So this just kind of illustrates that in a visual way. If I log in as Eddie Reese, Eddie can come into the Qlik environment, and what he sees within his portal is one specific application. And if he looks at that application, Eddie actually doesn't have the ability to edit it in any way. So if he comes in, he's simply viewing the data that he has access to. And you'll notice that because up at the top, there's no edit button for him there. So Eddie is very limited in what he's allowed to do, but he still has all the interactive capabilities that we saw all day today. If I log out as Eddie and I come in as someone like Eric here, Eric has access to a completely different application, in this case, travel expense management. But if he goes into his application, travel expense management, you'll notice that not only can he view his application, but he can actually create brand new sheets. So he has access to the data to build out his own visualizations like we had seen earlier on the iPad. Now, other users might have even more advanced capability. If I come in as Amy Wilson, not only can she administer the environment, but she could come in and create a brand new app from scratch. So just like we saw on the iPad, Amy not only has access to all the different applications available in the system, but she can come in and create that new application from scratch. So we take security very seriously, and as you see, Qlik is very powerful when it comes to dealing with that security. Taking a look at other questions, there was a question about contacting us and how to get the slides and additional information. So the easiest way to contact us is to send me an email at the email address that's on the screen right now. So JLINCHECK@copleycg.com. And if you're interested in any of the slides or the demonstration recording, please just go ahead and send me a note and I can get that over to you. I'll stop the sharing one last time to look at the final questions if there's anything else. It looks like we are good. So I want to thank you all for your time today. I always like to give people time back, so it looks like we ended up with some extra minutes, but it's always better for me when it's fast and furious. I know you all have very busy days and you don't want to spend too much time on a webinar, so I appreciate the time that you spent with us today. I hope that you are as excited as I am about the power of Qlik and Copley and how we can take your legacy business intelligence solutions and make it modern BI. I appreciate your time today. Everyone have a wonderful Thursday. Thank you so much. Bye-bye.